The theme of this year's World Health Summit is taking global health to a new level. It sounds great, but what does it mean? A new global agreement, a new global architecture, and a new global approach. Because health is not a cost, it's an investment.
Welcome to the World Health Summit 2022. For the first time together with the World Health Organization, we have decisions to make about new solutions in global healthcare.
Gesundheit ist ein Menschenrecht. Vielen Dank. I thank you. Thank you so much. Thank you.
Networking matters, cooperation matters, across national boundaries between different scientific disciplines and between the realms of science, politics, and society.
Here in this group, we have 4,100 participants from 141 countries, and we have about 60,000 online, and that's really a big success.
We are in Berlin at the World Health Summit organized by the World Health Organization, and with the NGIC taking a very active role in the program and in the number of speakers who participate in this most important summit.
We have a wonderful panel of speakers today.
President of Serbia, Boris Tadic.
Belinda and Croatia.
George Papandreou.
I'm honored to welcome Her Excellency, the former First Lady, Katrina Yushchenko.
I'd like to welcome Ms. Maria Fernanda Espinosa, an old friend.
Mrs. Tsipi Livni, the world remembers you as a former Minister of Foreign Affairs, but you're also representing here the Nizami Ganjavi International Center.
This is the first time that NGIC is partnering with one big multilateral organization like World Health Organization is. People from NGIC that are present in here are going to be participating in different sessions that are dealing with migrations in healthcare, that are dealing with healthcare for peace. There's about digital transformation that some of our members are participating in, and a lot of different topics that are related to it.
And the total number of the migrants who went through Bosnia and who was registered was about a little bit less than 100,000 people. In reality, we believe that it's at least 2, maybe even 3 times bigger because the people were not registered. Why? The government was not interested to register them, because if you register them, you have to secure them, you have to take even the health care of them.
I think a conversation on humanitarian health today will be incomplete unless we have input from that disaster, from that humanitarian health situation. Do we have Her Excellency on the line?
I think that the important thing that we know is that war is brutal and devastating wherever it happens. On the previous speakers, I want to say that indeed rape has been used as a weapon in Ukraine, and I thank you for all your support in that. And in general, thank you very much for the tremendous support that we have received.
In your region, which has experienced considerable conflict, you have found quite creative solutions to create bridges, particularly to the authorities of the occupied areas in southern Ossetia or in Abkhazia.
We've introduced free of charge healthcare, accessibility to the free of charge healthcare to the residents of both regions. They have the possibility to cross over and then have free of charge assistance of any kind that they need when it comes to the health assistance. A special hospital was opened right at the vicinity of the occupation line of the region of Abkhazia, for that matter. So one important takeaway that we've never made that a communication strategy in an open way. We understand the sensitivity of these issues. It's important for some of those to be off the radar screen, because the key is to build that confidence rather than just boast about it in terms of what we do, to be open and being encouraging connectivity of this type.
I became foreign minister at a time when there was high tensions between Greece and Turkey. We were almost at war. A few months in my term, there was a huge earthquake in Turkey. I decided to take a risk. I said, came in on television, I said, yes, they are our enemies, but they're human beings, first of all. Let's give blood. After 3 days, the doctors started calling me from the hospitals, and they said, can you tell people to stop? There are too many people coming. We cannot deal with this. So what we were doing, actually, we gave agency to our citizens to deal with this conflict and feel that they could be part of dealing with this conflict.
President Tadic, what opportunities do you see at an international level for health to be a unifying platform or opportunity for collaboration at an international level?
Whenever I'm participating on such forums, I'm insisting on creating a kind of global health diplomacy to bring more expertise in multilateral institutions. The people that are able to be focused on potential conflicts, to identify zones all around the world that are right now existing as a conflict, but also to identify the zones that can be conflict in the next 2, 5, 10 years, which is real, very important prevention. I'm using the example from medicine. The prevention of the disease is a key.
Two issues are the most important things for us. One is resilience and preparedness for the new challenges, some next pandemic or whatever it is. But another one is healthcare for all. No one being left behind when it comes to healthcare. How to have healthcare as a basic human right. So this is the reason why we want to be more advocating, changing of nature, of attitude of the global players to the health, and how we can have people-centered health.
And so first, I want to appeal today to rich countries to raise their development aid budgets, not least to meet the gaps in funding that the WHO, ACT-A, and the Global Fund currently face.
The digital health can be incentive to promote and to invest more in digitization, because until now, digitization was mostly about information. Now it's about life and death. And part of the outcome or the results of the Israeli experience is that it cut the budget. When you're using digital health, in the end of the day, you are paying less.
Maria, you are more knowledgeable about the UN system probably than anyone else in the world. The question is, what must be done to catch up? Where do we move forward?
The good news is that we understood, because of COVID-19, that we need a profound retooling of the multilateral architecture, not only the multilateral health architecture. And that's why I am personally so involved in the UN reform agenda. And it is about more smart funding of the whole system, not only of WHO, but to have greater accountability, greater inclusiveness, and greater democracy in the multilateral scene.
General conclusion on the global level, we definitely need more solidarity. We need more empathy. We need to realize that health is a human right and a public good. I am very glad that the NGIC decided to participate, because I believe that we have so much to say on this topic, which is one of the preconditions for building human security, tolerance, and understanding, the principal business of the NGIC.
Ten years ago, you had the vision that former heads of state still have a contribution to make to the world with their experience and their advice. You have turned this vision into a reality. In these challenging times, we need your voice now more than ever. Thanks to your collaboration with WHO, your voice on global health issues has been amplified, including at the recent World Health Summit in Berlin. I thank you.